I would now like to turn it over to Representative Patrick Abrami to introduce House Bill 1644.
Thank you, Mr. Chair. For the record, statement Pat Abrami, Rockingham 19 Stratum. This bill has to do with cell tower placement, actually antenna placement, because these antennas go on things other than towers as well, and about a registry for radio frequency sensitive residents. Before I discuss the details of the bill, let's talk big picture. It's important to say out front that we love our cell phones. This is nothing to do about that, but we should, as a state, ensure the technology around us is safe as practically possible. With this bill, cell phones will live on, but hopefully in a safer manner. How many members of this committee would be happy with a cell tower going up at the edge of their property line and not being able to stop it? This happens frequently in our state, where residents find themselves hopelessly without any recourse but to accept a cell tower going up near their property. My experience in my town shows that this happens all the time in my neighborhoods in Stratham. My residents call me when we're looking at a new cell tower. And most residents argue aesthetics, property values, but most important, health concerns. One recent case that I was involved in our planning board, we had an electrical engineer who was arguing the health concerns, but he didn't get very far. Why didn't he get very far? Those town planning boards eventually give in because the FCC is all powerful because of the 1996 Telecommunication Act. Before the 2019-20 term, the issue of radio frequency radiation was brought to my attention, especially with the emergence of 5G. I filed a bill to examine this. That bill, to form a commission, passed this committee and on the floor. It passed the Senate Health and Human Services Committee and passed on the Senate floor, and the governor signed it. That commission, chaired by me, met for 14 months, produced a 390-page report that includes the appendices and the minutes. Included before you on your desk is the body of that report that has been cited around the country and even in federal court case. The wording of our bill, the bill formed a commission that several other states have as well adopted for that type of commission. Here were the major conclusions. The federal government, and specifically the FCC and FDA, have ignored the science from around the world on negative effects of radiation that is around us in ever-increasing levels. We reached out to the FCC and the FDA, who responded but never answered our questions. The EPA, basically, when we reached out to them, the EPA basically said, not our job. And besides, we have no funding to study this. So basically, there's really no one in the federal government that is dealing with this issue on the health level. Our conclusion was that one needs to ensure safety of citizens against overexposure to RF radiation, and we concluded that the state of New Hampshire needs to control its own destiny. We concluded that beyond the health issues, a return to some control to the state of its political subdivisions, just from a planning standpoint alone, should occur. Note that countries and cities around the world are also dealing with this issue, and most already have stricter standards on RF radiation than we do. In the US, many cities and towns are working different ordinances to attempt to retake control of this issue. Some have been challenged and others have not. This is why, if you check your legislative email, you will find letters of support from around the country and the world. In the state of California, the firefighters have lobbied for and achieved exemptions from forced placement of cell towers on their fire stations because of health concerns from radiation. The 2015 California Assembly Bill 57 used the phrase, due to the unique duties and infrastructure requirements for swift and effective deployment of firefighters. to get around the FCC so that no cell antennas could be placed on or near any fire station. So they came up with a way of getting around the FCC. So it can be done. In the news recently is the one federal agency, the Federal Aviation Administration, who understands the science. The FAA and aerospace industry groups say tests show devices that or calculate altitude could become unreliable if aircraft get too close to 5G towers. With that, the cell companies have agreed to delay the turning on of the 5G service near airports. There was never a concern with 2G, 3G, or 4G, just as the FAA is concerned. Thousands of scientists are warning as we go further up the electromagnetic spectrum using higher frequency waves and power density, as 5G does. There will be negative impacts. The waves can alter altimeter readings. Then what can they do? Increased non-ionizing radiation can do to humans. Courts have said that the FCC's interpretation of science, to me ignoring the science, is arbitrary and capricious. It is a wake-up call to the state. I want to point out from the bill, if you go to the, I hope you read the findings and purpose. But if you go to line 20 on the first page, on August 13, 2021, the United States Court of Appeals for the Circuit District ruled in a case brought by the Environmental Health Trust and Children's Health Defense that the Federal Communications Commission's decision in 2019 that their radio frequency emission safety guidelines dating back to 1996 were adequate to protect the public was arbitrary and capricious in its failure to respond to record evidence and in the violation of the Federal Aviation Procedure Act. Specifically, the court said, and then what's in quotes is the actual, was actually in the ruling. That failure undermines the commission's, meaning the FCC, concludes regarding the adequacy of its testing procedures, particularly as it relates to children, and its conclusions regarding the implications of long-term exposure to radio frequency radiation, exposure to radio frequency pulsation and modulation, and the implications of technology developments that have occurred since 1996, all of which depend on the premise that exposure to radio frequency at the levels below its current limits causes no negative health effects. Accordingly, we find those conclusions arbitrary and capricious as well. Finally, we find the Commission's order arbitrary and capricious in its complete failure to respond to comments concerning environmental harm caused by radio frequency radiation. So that's the conclusion of the Court of Appeals in the DC District. I was going to read this today, but I guess I don't have time. It's on your desk from the Executive Director of Environmental Health Trust, who filed, one of the people who filed the court case that does a lot more explaining of what I just said there. That's before you. So now let's discuss the bill. The first page, the first two pages plus the top of the next page is really the purpose statement. And at the end, we conclude public health and safety is the primary responsibility of local and state government. The state's rights in this case should not be superseded by the federal government. The first of two things in this bill does is talks about telecommunication antenna placement. And this is on the top of page 3, starts at line 6. I'll just read it to you because it's only 3 lines. The placement of telecommunication antennas on any existing structure, existing pole, new pole, or tower constructed after the enactment of this paragraph shall be placed at least 1,640 feet from residentially zoned areas, parks, playgrounds, hospitals, nursing homes, and daycares, and schools. So first you're going to say, well, why 1,640 feet? That's 500 meters. And that's where the science has shown that health effects diminish after 500 meters. Just to give you a reference, that's 5.5 football fields. Dr. Kent Chamberlain, Emeritus Chair of the UNH Department of Electrical and Computer Engineering, will be testifying on those studies.
2 minutes.
Okay, thank you. So the second thing is that radiation exposures. The second thing is to set up a radiation exposure registry to be maintained by the HHS, which costs borne by the operators of wireless antennas in the state. There's 3 points. Yes, there are people who are actually radio frequency sensitive to the point that there is healthcare ICD code for this. Being on the Ways and Means Committee for 12 years, I am aware of many fees that fund things that are buried in the cost of the product. An example is that there is a fee per gallon of home heating oil that the distributors pay for things like the Safe Tank program. That doesn't appear on the oil bill at home, but is built into the price of the gallon that is charged at the wholesale level. In our proposal, this fee would be very small when distributed across all users and wireless devices. So we're suggesting that we do a similar thing in terms of bearing the cost of this reporting mechanism. The fiscal note indicates that it will take $750,000 to get this database built and another $230,000 annually to run this. It is our position that these development maintenance costs are inflated. We can go to UNH and give them a $100,000 grant or less to develop a database that I'm sure they would gladly accept. We also feel that the maintenance in the database could be absorbed by existing staff, possibly the addition of 4 to 6 hours per week of someone's time. Because the bill calls for, well, not the bill, the fiscal note says that we're talking about adding 2 people.
Okay, Representative Abrami.
Can I just give me one half a minute, please, sir?
Okay, one more 30 seconds.
Finally, the idea of database is independent researchers will have access to the data to do analyses. We're not asking HHS to do any of this analyses. You'll be hearing from experts and citizens alike on the science, why 1,640 feet, the failures of the FCC and FDA, what is going on in the worldwide and nationally on this topic, and how local governments are pushing back. Mr. Chair, in conclusion, I know your committee will give full consideration to this bill. If there's a full committee work session or subcommittee planned, I will be there to help in any way I can, and I will bring experts with me. So with that, I thank you for the time. And again, there's a couple of handouts I gave in addition to the ones I held up that talk about what's going on federally, why these things are going to the courts. It's because there's a failure on the part of the federal government to do its job in regulating this. It's clear. I'm not an alarmist. That's not me. But when you look at this, as long as I have, I've come to the conclusion that something needs to be done in this area. Thank you,
Okay.
Mr. Chair.
Great, thank you. So I'd like to open it up now to questions from the committee, and Representative Pimentel is recognized.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Thank you, Representative Abrami, for your time. Just one question. I know it seems like the FCC has been looking the other way on this. Is that true in other countries? Do we have some kind of something to look at where they have taken to understanding this a little more thoroughly?
Well, they have, because most countries have more stringent standards than
Don't forget to speak into the mic.
Yes. All I can say to that is that when you look at what other countries have done in terms of their standards, they're much more stringent than ours. And there were signs there that they actually have signs backing up their standards. We have no signs backing up our standards. And that's why the court case ruled the way they did, because they were trying to say, no, those standards we set back in 1996 are still okay today. In 1996, I think we had 2G, if that. Now we have 5G, and no one's looking at what the impact of that is. And the courts, I think, ruled in the correct manner that they did. Thank you.
Okay, Representative Thomas is recognized.
Thank you, Mr. Chair. Thank you for taking my question. Aside from the health aspects, establishing the distance of 500 meters, which I believe is highest priority, did the committee study or run across any other information involving how 5G would affect any operational aspects of equipment or any other items, people's health notwithstanding? I'm just curious if they found any, if they found anything in terms of distance, optimum distance and so forth.
But yeah, there are certain distances that but the main one is the sighting of antennas distance. We also looked at the environment in general, what it's doing to the bees, what it's doing to plants and all that. But we didn't address that in this. We're trying to take one step here and really just try to get the setbacks. And by the way, that setback, we're not going to disturb any of the antennas that exist today. That'd be an impossible thing to do. We're saying let's just look forward and have a rule that says 1,640 feet, and just basically residential areas, by the way, in residential areas, as well as the schools and all of that may not be in a residential area. So we're trying to be reasonable here. You know, if there's a lot of land near the road, you see a lot of cell towers along the highways. Usually there's not many homes there. It still can be, they can still be siting cell towers in those areas. Thank you.
One follow-up.
Follow-up?
Thank you, Mr. Chair, and thank you for the follow-up. So, just curious, in view of the recent information that's just come out on the from the FAA, at any time did anyone from the Manchester Airport come to your committee and discuss issues with distance to the airport and how it might affect its operations?
No, I think that's really breaking news the last couple of weeks. Obviously, the FAA and the aerospace folks have been looking at this before. People think that 5G has been deployed a lot. It hasn't been. It's getting there. It hasn't been fully deployed. But then they started to see that there's sensitivity to the instruments from 5G. Now, there are a lot of towers near current airports that are 2G, 3G, 4G, and that was never an issue. Why is it an issue now? Because I think the power densities are a lot higher. We're into millimeter waves, and we're just finding out how it's impacting instruments, but if it's impacting instruments, what is it doing to humans? So that's all we're saying here.
Thank you, Representative Jackie Kelly-Pitts.
I have one question. The FAA itself is conflicted right now about how many seconds they need to have this cell tower deactivated. My question is, has the case from the district court ever been appealed? And is it going to be appealed as far as you know?
At this point, it hasn't been appealed.
Thank you.
And I would really suggest that you read this piece. There's this piece and this piece. It gives you the whole history of this one, and this one tells you what happened with the court case in detail. And it gives you what the next step is going to be in the court case. I wasn't able to read it. I was going to read it. Thank you.
Thank you. Representative Notter is recognized for a question.
Thank you, Mr. Chairman, and thank you, Representative, for taking the question. It actually is from a colleague who couldn't be here. Regarding the $1.5 million over 3 years to implement a very tiny database, including hiring 2 database personnel plus a $500,000 a year support contract. Couldn't this be built and secured with something like Google Forms in a few days?
Again, my bill didn't specify that. That was the fiscal note. The fiscal note, that, if we read it, I can't remember if it was Well, we recommended that the HHS run this database because they do run it at other data. I did talk to them a while back. We never talked about the cost. I think they went to the Department of Energy. I don't know why the Department of Energy, but they went to the Department of Energy. I think they should have gone to the EPA, the Department of Environmental Service in our state. But with that said, we don't agree with that fiscal note at all. This can be done. I mean, this is a simple database, and it's not. We're not asking HHS to actually manipulate the data. We're just saying house it in your area, and you know, we will make sure that the data integrity is there, and then we're opening it up to researchers to then access that data and do whatever analysis they want to do. Basically, what we talked about in committee was that trying to identify hotspots in the state where and using human feedback as one of the indications that people who are feeling sensitive to this frequencies. One of the things we had talked about was actually doing testing, because nobody tests on an ongoing basis whether the even meeting current, if we're even meeting current levels of radiation exposure right now. But so we could have put a whole bunch of things out forth to the committee to consider, but we tried to narrow it down. Let's take a step at a time. Thank you.
Okay. Follow up?
Follow up?
Thank you. Same colleague who couldn't be here today said that he's looked at a lot of studies, and most of the studies he's seen has referenced are about cell phone radiation and not cell tower radiation. So my question is, what's the difference between the two?
Well, your phone has like 6 antennas in it. Your phone has 6 antennas in there. One for your GPS, one for your, for your phone. There's a whole bunch of things. That's a whole other issue we looked at. Again, we chose not to bring that forth. We talked about having warnings, on a whole variety of things that we thought that would help the situation, but we didn't think it was practical for just New Hampshire to handle on its own. It's really a federal issue. Now, one can argue that what we're talking about here is a federal issue, but we're saying, okay, New Hampshire, let's be bold. Let's start with the cell towers, and let's move forward and coming up, because there are communities, and I meant to say this. Let me say this real quick. There are communities that are coming up with ordinances in terms of this. The only problem with the ordinance, and we're going to hear from Senator Riccardi. She did that in Bedford. And there's others here that are going to speak about other ordinances. The problem with the ordinances is that we're relying on the town to do the battle. And I think the state has to help them out and give some voice for these communities. Because let me tell you, this battle is going on everywhere. And yes, and I'd say, no, let's not look at the aesthetics. Let's not look at that. What's the real issue here? The real issue is exposure, overexposure. And again, like I said earlier, none of you would like it if someone put a cell tower in your backyard. You have one? Oh, look, that's why you glow so much. Just joking.
Representative Platt is recognized for a question.
Yes, thank you, Mr. Chair. Thank you for taking my question. 5G is new to telecom, but it isn't new. The FCC auctioned that frequency for use in telecom. What was it used for before, and did it cause a concern then?
Well, I have people behind me that could probably answer that better than I can. But I think those auctions were for, they knew, because 5G is a concept, first off, and it's a marketing issue, okay? Every telecom company has a different strategy for rolling out its 5G. And some have talked about small cell towers, and they needed millimeter waves, which are far further up the electromagnetic spectrum. And so, but they're way ahead. Even if they were auctioned off 5-6 years ago, they wanted to get those for the next generation. But you would say, well, gee whiz, why didn't anybody test this? Why didn't anybody see if there's any health issues around that? And that's basically where we're at right now. So I'm not sure if there were other uses for the 5G. It's really the millimeter waves. Again, if you know, like you guys are science tech, the electronic spectrum, radio frequency waves. Now we're getting further up the spectrum. Thank you.
Thank you. Representative Harrington is recognized for a question.
Thank you, Mr. Chairman. Thank you for taking my question. Referring to page 3 of the bill where you talk about the radiation exposure registry, this is kind of really wide open. I mean, radiation comes from a lot of places. For example, if you share your bed with someone, you're going to get a lot more radiation than if you sleep alone. How is this going to be limited to wireless radiation exposure where there's so many other possible sources of radiation that could come from anywhere?
Well, I agree. This is broader than just the cell towers, this thing. I mean, there are people who are turning off their routers because they're feeling the routers, okay, in their house. And we stayed away from smart meters. A lot of people, and believe me, since I've been involved in this, I get emails and mail every day from people, why aren't we doing something with smart meters? And I know there was a bill a couple of years ago on smart meters, but it was not properly presented or thought through. Because there's 3 levels of smart meters. One is the truck goes by, that goes on. There's one that pulses maybe a couple times an hour, and then there's the others that pulse continuously. And those are the ones we should be concerned about, the ones that pulse continuously. So I'll
Okay,
just leave
thank
it
you.
at that.
Thank you.
Could I follow up, Mr. Chairman?
Follow up?
Yeah, you had mentioned this fee was going to be embedded in the cost. Would you be, because that is one thing that I really don't like, hidden fees that people don't know what they're paying for. And if there's going to be a fee, maybe it should be out there so that everyone knows what they're paying for. Would you be willing to amend the bill so that the fee would actually appear on somebody's telephone bill so they know what they're paying for?
Yes, but I would venture to say, first off, the costs I think are inflated. When you take a lower cost, because I think the state can do it a lot cheaper than this.
Well, whatever the cost.
All right, but it's going to be so minuscule. When you spread it across the number of cell phone users or people with pads or whatever, end users, and then we're saying, well, why don't we do it this way, like we do with the oil companies, as one example, is charge it at the wholesale. They would be the Verizon, AT&T, whatever level. And it's, again, the ongoing cost is on, even at the high end, it's $230,000 with 2 people, but I don't think they need 2 people to maintain this. So, yeah, sure, if you want to amend,
Thank
that'd be good.
Representative Ploget is recognized for a question.
Thank you, Mr. Chair. Thank you for taking my question, Representative Abrami. On page 3, in regards to the radiation exposure registry, it looks like it's up to the residents. My question is, right now, is there any documentation, ordinance, regulations that gives the documentation for the frequency, power density over time already that they emit?
Not that we're aware of. There could be.
A follow-up?
Follow up.
Thank you. It's going to be hard for me to see with this bill going through, if that doesn't exist, what do they use that information against?
Well, what is known though is every antenna is registered, so we know what the antennas are. You can look it up. So all of a sudden because you got to remember, part of the problem is it's one thing to have one antenna. What we're just learning about is how these antennas interact with each other. So so you could be in a neighborhood that has a lot of antennas, and we're not picking on anyone. We're just trying to say, listen, there seems to be a lot of sensitivity to the energy coming out of these antennas, and maybe just to be able to start documenting this, we have to start somewhere to try to start documenting. Then we said, well, why don't we work with? There is an ICD code for radio sensitivity. But not everybody, and there are people who are actually coded that way in their medical records. And we can talk more about that at some other time if you'd like. So it isn't like it's not recognized in the healthcare arena, it is. Okay, thank you.
Okay, Representative Bernardi is recognized for a question.
Thank you, thank you, Chairman, and thank you, Mr. Abrami. My question focuses in on the 500-meter limitation. It does not appear to be tied to any power limitation or power density from these antennas. So, as an example, that little red light can be seen for a certain distance. If you cranked up the power, you could probably see it for a much greater distance. But you've just limited this to 500 meters. What, if we're concerned with exposure, we're concerned with a certain amount of energy that's being distributed. So how is a 500-meter limit controlling this?
Because what happens to these, it's, yeah, you're right. Power density is the key thing. And then we talked about in the committee, well, how do we do this? I mean, because they can manipulate the power density, different times of the day, whatever, so we thought the easiest thing to do is just to put a limit. Now, there's some science studies that'll be talked about by Professor Chamberlain in a minute. You could probably do a better job at answering your question, if you don't mind. Okay, but
That's fine, yeah.
and but again, it's not the 500 meters isn't just, we didn't pick it out of the air. No pun intended. But there's science behind that.
Thank you.
Follow up? All set, okay. Representative Thomas is recognized.
Thank you, Mr. Chair. Thank you for taking my question, and I'll do a follow-up question based on Representative Bernardi's question. So my question would be, in reference to the 500 meter, would there be or could there be an associated power limit associated with that distance if regulations were created and produced? Because I don't know how much power is created to transmit 5G, but is it possible to combine the two in either your bill or some other regulation that would set this record straight?
We definitely want to.
Before you answer, Representative Abrami, I need to apologize to the members of the committee. We have a rule that says no member shall ask more than 2 questions of a given witness. And I just violated that rule by allowing Representative Thomas to ask a 3rd question. So I apologize to the committee. I won't let that happen again.
My apologies, Mr. Chair. I interpret it to mean 2 separate questions, but thank you.
Well, to answer your question that wasn't asked, that we would welcome that discussion with you to try to look at it, because you've got to remember, on a tower there's multiple antennas. I mean, you ever seen a tower with 1 antenna? There's usually 15, 20 antennas all pointing in different directions and all that, and then you got to look at the cumulative effect of all of this is the real issue.
Okay, thank you.